start with Jessica Cait. She is a postdoc here at the University of Guelph. She's going to be talking about social isolation in research rodents.
Okay, got it to work. Hello, thank you for the intro and thank you for the conference organizers for having me. I'm excited to talk to you guys about some very, very new data on social isolation in laboratory rodents. It's a recent meta-analysis that we have been conducting. So there are a lot of basic housing and substitute practices that occur in laboratories that compromise rodent welfare that you're probably familiar with. So they're tail handled, they're restrained, they're often housed in social isolation. And one of the most common and well-studied ones is conventional barren shoebox cages that are void of resources that allow species to co-reproduce. And so from human literature, we know that psychological stress has physiological consequences. So humans reporting high levels of stress show accelerated disease symptoms and increased mortality rates. And so more specifically, although there are many health effects of chronic stress, some diseases in particular seem to be very sensitive to stress. So I have a list of 7 here, although there are many others. The 7 that seem to pop up quite often are cancer, cardiovascular disease, stroke, anxiety, depression, viral infections, and asthma. And these are all exacerbated by stress in humans. And then importantly, there's an additional effect of stress, just generally increasing mortality rates. And so in 2 previous studies, we used systematic review and meta-analysis methods to test if conventional housing imposed similar physiological consequences. And just to intro quickly what a systematic review is, just for this session, is a systematic review is different than the normal narrative reviews that we're used to. The idea is that they're supposed to be very rigorous. The criteria is pre-specified, and you're supposed to be able to gather all of the potential evidence that's available to answer specific research questions. And then a meta-analysis just means analysis of analyses, and so it's a statistical method to synthesize data from multiple studies. And one thing that's really great about systematic reviews and meta-analyses is that they don't use any additional animals, so it's a really good way to reduce animal use. And so we use systematic review and meta-analysis to test a hypothesis, and we were looking to see if conventional housing increased morbidity and mortality compared to rodents in better cages that were enriched with resources. So I named 7 on the previous slide. We were able to assess 5 in the literature just based on what was available. And so we found that across all of them, we saw that conventional housing exacerbated morbidity compared to rodents in well-resourced or enriched cages. And the effects were medium to large in size. So conventional housing had a medium to large effect of exacerbating disease. And so we also looked at mortality, and so death could be measured in 2 different types of studies. Ones where rodents were left to live out their lives in their cages, and then mortality occurred spontaneously, and then it was reported by researchers. And then they also had studies where the disease was actually induced by researchers, and then they looked at the mortality that occurred due to the disease. And in both cases, we found that mortality was increased in conventional housing animals by about 50%. But of course, these findings might not just be about conventional housing. We wondered if similar effects could be seen across different common laboratory practices, and specifically, we're really interested in social isolation. And so around the world, there are a lot of recommendations about social isolation, specifically the CCAC in Canada and the Guide in the US. Both make recommendations about social isolation. And so both generally say that single housing should be avoided for rodents when possible, and if it is going to be used, it has to be just. And this is based on our understanding of wild mice and rats, which we know are social, and it's also based on several papers that demonstrate that both mice and rats in the laboratory prefer to live in groups. But beyond this preference data, it's actually hard to say how bad social isolation is for rodent welfare. And there's surprisingly a very limited amount of data on the subject. So I found this quote that was from 2006, so a little while ago now. It says today there is no strong scientific basis for concluding that individual housing always imposes a major welfare problem in mice and rats, and more and better controlled studies are needed. But since 2006, we actually really haven't had much more data on this topic. So there are, some physiological parameters, some harkens data, but beyond that, we're pretty limited in our welfare knowledge. And one problem with this is that making recommendations ubiquitously for all rodents might be a problem because not all rodents might benefit from social housing. So one example is the male mouse, and if anyone's worked with male mice, they can be quite aggressive towards each other, especially when we're trying to improve their welfare by giving them resources for enrichments. They can become quite aggressive and resource burned. And so we wondered just how big of a welfare problem is this if, just like stressed humans and just like conventionally paralyzed rodents, social isolation causes sufficient stress to compromise rodent health. And so if it does, it would be really good evidence to be stricter on our practices in the laboratory about when we do social isolation. And so our hypothesis made some specific and testable predictions. So compared to group housing, isolated rodents would be more severely affected by those 7 diseases I outlined, and it would also show increased all-cause mortality. And if the effects were similar in severity to conventional housing, we would expect these effects to be medium to large in size. And so to conduct our systematic review, we were looking for biomedical research that was comparing 2 different treatments, a socially isolated group and a socially housed, either in groups or pairs. And so otherwise, the animals were treated identically, so they're given the same disease model, same housing, etc. The only difference was their social condition. So our search yielded 120 articles, and they contained 204 relevant studies of different groups. And we found data for 6 of our 7 stress-sensitive diseases because asthma was never studied. Our data set was skewed towards mice. Most of our animals were mice, and our data set was also skewed towards males. So the majority were done on male animals. Okay, so the story here is less clear than with our conventional housing. I'll start with the ones that supported our hypothesis. So first, with anxiety and stroke, we saw an increase in morbidity in both of them, and the effect sizes are listed below. But for anxiety, we had a medium-sized effect, and for stroke, we had a large effect. So similar to what we'd see in conventional housing. So both of these support our hypothesis. And then things get a little bit messier. So we had 2 diseases, cardiovascular disease and viral infection, that were both very underpowered. So you can see below they each had an N of 4. And so neither of these showed an effect of social isolation exacerbating disease, but these could be false negatives because they're very underpowered. So for these, it's kind of hard to make a conclusion. But then we had 2 diseases, cancer and depression, that were both well-powered, that showed no difference in disease severity between socially isolated and group-housed animals. And so these did not support our hypothesis. The results are also a little bit confusing for mortality too. So for animals that died a natural death, we did see an increase in mortality in socially isolated animals, about 57% increase in mortality. But we didn't see the same thing across animals where the disease was induced. The one big caveat here is most of the diseases that were induced were cancer. And I just showed you on the last slide that we had no effect of cancer. So this might not be a result of increased mortality, but rather no difference in the actual disease. And so essentially we had 2 diseases that were likely underpowered, 2 that failed to meet our prediction, and then 2 that met the prediction. And then for mortality as well, we had an effect in naturally occurring deaths, but no effect in induced deaths. So how can we interpret these mixed results? Well, one is we can say that unlike conventional housing, our hypothesis was only partially supported. And so we had effects in some forms of mortality and in some diseases and not others. One partial explanation for this is, as we saw, there was such a variety in the sizes of our effects. It probably means that some diseases are more stress sensitive than others and are able to pick up on this. And the other important thing is perhaps that social isolation isn't ubiquitously bad like we saw with conventional housing, but it might be only bad for the health of some rodents and in certain contexts. And this is particularly important because our data set is skewed towards male mice, which are the ones we know are least likely to benefit from group housing. And so I have done some analysis that address these questions. I don't have time to talk about it. You can ask me in that question period or you can come find me to talk about it. But the important thing is that we really just need more primary data to understand which animals benefit from group housing and in what context they benefit from group housing. So the call to welfare researchers to do more of this research so it can really inform policy and we can do better in the laboratory. Mice health and welfare. And then just to end here, because it is in the title, but I don't have enough time to talk about the data again. If there are some animals, we saw in some diseases, they were affected by social isolation. And so if these models do have health effects for socially isolated rodents, then it might not just be a consequence for welfare, but it also might impact our scientific data. And then this has knock-on effects for replicability and translatability, which we know are major problems in environmental research. And so I'm happy to take questions.